Good afternoon, Jeremiah here to instruct you on how to properly insert an OPA. If you're wondering, yes, I'm wearing a jacket inside because it's 56 degrees in our training center. So an OPA is used on semi-conscious or unconscious patients with no gag reflex. Right? We use OPAs because when a person becomes unresponsive or unconscious, the muscles in the jaw relax and it allows the tongue to fall and obstruct the airway. So we want to prevent that, and what we'll use is a hard J-shaped piece of plastic known as an OPA. Two types of OPAs out there. One has a channel on each side. These are called Berman airways. You also have OPAs that have a hole in it. These are known as Goodell airways. Which one you use doesn't matter. Knowing the name doesn't matter. So like I said, we're going to use OPAs on semi-conscious or unresponsive patients with no gag reflex. If you insert this and the patient starts to gag or it initiates vomiting or retching, we need to remove it. Remember, size matters. So first thing we're going to do is choose the appropriate size OPA, and we want to measure. We're going to measure from the corner of the patient's mouth to the tip of the ear. Once we measure, we're going to open the airway using a cross finger technique, scissor technique. We're going to insert the airway, tip towards the roof of the mouth. You're going to slide it forward. Once you reach the crest of the tongue, you're going to rotate the OPA 180 degrees. The flange of the OPA should then sit on the patient's lips. I have seen it done where they sit it on the patient's teeth. I don't like to put anything on the patient's teeth. Prefer that you sit the OPA flange on the patient's lips. If it's seated correctly, it'll help to keep the tongue from falling behind the back of the throat. It's that easy.